I have chosen a few specialities which generally Indians try to specialize. In case you have any further questions about any other further speciality, you can email me or you can email Deepak, and these are the few subjects what I have chosen. And at the end, if you see, I have chosen something called a Suzarsweiter. Suzarsweiter is if you specialize in one subject and you get small specialities further in your field. Now, I'm not going to talk about also every Suzards Weiterbildung opportunities and what are there. There are around 56 Suzards Weiterbildung options in what is available. So, in case you have any other further in mind, so please go ahead, email me or Deepak, and we'll be very happy to provide you the details. So, we'll start with internal medicine first. Now, these are the specialities what you can in internal medicine which you can specialize in. For the internal medicine, as such, there are two options. There is first one, internal medicine as such. Now the internal medicine training takes around 5 years, in which you have to be for 4 years you have to be in internal medicine or in two different specialities. The 30 months has to be in inpatient care. That means you can do a part of your training in an outpatient care as well. 6 months has to be in an emergency room, or like the Setena, what they call in Germany, Zentrale Notaufnahme, and 6 months has to be in ICUs. Now, internal medicine with subspecialty. A lot of people confuse and they don't know about it. People say that they want to do first internal medicine and further on specialty. That is one option. And for some people, it is a good way as well. But there is another option that you can directly specialize in the specialty. For example, you can, like me, I'm doing my specialty in pulmonology. So I can get it directly in pulmonology, which will be internal medicine and pulmonology, in which I have to do it for totally 6 months. On from that, I have to be in for 6 years in pulmonology. 2 years from that, I have to be in inpatient care. That means that I can spend totally 3 years in inpatient care, or 2 years in inpatient care and 1 year in outpatient care. 2 years in other specialities, 6 months in Setena again, or the Centrale Notaufnahme, and 6 months in ICU. What's the difference? If and let's say if some people say that I will want to do in first in internal medicine and then in subspecialty, for those people I will suggest that you first think in which specialty you want to choose, because in total you must have to have 3 years in that specialty. For example, you do your 5 years of internal medicine, and out of which you spend 1 year in a specialty, in, let's say, cardiology. Now, after doing your internal medicine, uh, because you have already done 1 year of cardiology in this internal medicine training, then you can do your cardiology in after just for 2 years with that. What's the difference? The difference, if you are planning to go out in an outpatient setting, or you are planning to open your own practice after your Fachhausprüfung, then you can license many more things as comparative to if you directly do your subspecialty. I can just give you an example. For example, if a person has done first internal medicine and then the subspecialty, and he plans to go to in a praxis, then he can ask the Kammer or the medical authorities that that they license him a few more procedures, so that they can bring him more money. For example, as a pulmonologist, direct pulmonologist, I can't do an echo or echo. But if I do my internal medicine first and then the pulmonology, then I can do echo in my praxis or the clinic as well. Now, these are small differences. Uh, there are many more differences, which is for because of the time limitation, which is not possible to cover everything here. In any, if you have questions, we'll be again at the end, we'll be very happy to answer them. Coming down to our second topic is the surgery, and these are the specialties in which you can specialize in surgery. The general surgery takes around 6 years, uh, and out of which 18 months or the 1.5 years has to be in orthopedics and trauma surgery, 1.5 years in visceral surgery, 6 months in notaufnahme, and 6 months in ICU. If you want to do it with subspecialty, then again it is of 6 years, out of which has to be in 4 years in respective specialty, 6 months in note of number, 6 months in ICU. And coming down further, the third specialty, what I'm going to talk about is the pediatrics and its subspecialties. Now, the pediatrics takes 5 years, out of which 6 months has to be in ICU. Now, if you want to, here is a difference. If you want to do a specialization in pediatrics, you, unlike internal medicine, you can't do it directly. You have to first specialize in pediatrics, and then you have to spend 2 years in that respective specialty. Coming down further, the general medicine or family medicine takes 5 years, out of which 2 years has to be in outpatient practice. Unlike internal medicine, where most of the time has to be spent in an inpatient practice, here it has to be mainly outpatient practice. 1 year in the inpatient practice, 6 months in any other area, for example, hematology, oncology, pulmonology, cardiology, and so on. Here, what is also important is you have to do 80 hours of psychosomatic care, which is done through different specialized courses. Coming down further, anesthesiology. Again, anesthesiology is 5 years. Sorry, take 5 years in anesthesiology, from which 1 year has to be spent in intensive care medicine. You can do 1 year of training in any other field, such as internal medicine or surgery, depending upon your choice. And if you don't want to do it, it is okay as well. Coming down further, radiology, 5 years of training further, and uh, um, it can and you can do 12 months of training in any other field, such as internal medicine or not. There are two subspecialties associated with radiology. It's like pediatrics, that you have to do first radiology for 5 years, and then you can specialize in subspecialty after doing 2 years of training in the subspecialty. Coming down further, obstetrics and gynecology, that is, you have to do 5 years of training in obstetrics and gynecology. You can do 1 year of training in any other field, that is, for example, such as internal medicine, it gets also counted. You have to do 80 hours of psychosomatic care as well, which is done through the courses. Now, there are three subspecialties which are very loved here in Germany: reproductive medicine, oncology, and perinatal medicine. It's again like pediatrics. You have to first specialize in obstetrics and gynecology, and then you can do 2 years of training in the respective field. Then coming down to psychiatry. Psychiatry is again 5 years of training, out of which 1 year has to be spent in neurology, 2 years has to be in inpatient care, and the rest can be done in outpatient care as well. There is one subspecialty, forensic psychiatry. For that, you have to first specialize in psychiatry, and then you can do 2 years of further training in forensic psychiatry to get yourself subspecialized in that field. Then is the urology. Urology is again 5 years of training, out of which you can do 1 year of training in any other field. Now coming down to the Zusatzweiterbildung. As I said, there are 56 different Zusatzweiterbildung, what you can do. I'm not going to speak about every 56 Zusatzweiterbildung. I have chosen these 20 from that 56. And we can, if you have further questions regarding any other subspecialty, we'll be very happy to guide you about that. So the first is the allergology. Allergology is available for who are specialized in internal medicine, pulmonology, cardiology, pediatrics, ENT, or the occupational medicine. It is done through specialized courses and the 6 months of training in an allergy lab. Andrology, this is available for the who are subspecialized in endocrinology or urology or venereal diseases. That is, this training takes around 1 year. Pediatrics medicine. The people who don't know about the pediatrics medicine are the doctors who work in, for example, in industries or in companies and take care of the workers over there. So this is done with different courses, 360 hours of advanced training course and 1200 hours of company medical activity under authorization. Can be replaced by 9 months of further training under authorization at further training institutes. Diabetology, it's available only for the general medicine or internal medicine or the pediatrics or the endocrinologist. The training takes around 1 year. Nutritional medicine, these specialists in the area of immediate patient care. With immediate patient care means the doctors who are trained for the inpatient care. For example, it can be internal medicine or any of its subspecialists or the pediatrics or the surgeons. That means it can be done through any specialty apart from the family medicine, because their training is mainly done in the outpatient setting. That is done through 100 hours of advanced training courses and 120 hours of seminars. Coming down to geriatrics, it is available only for the general medicine or family medicine, internal medicine, neurology, or psychiatry, and so on. That is, the training takes around 1.5 years. Gynecological exfoliative cytology, as the name suggests, it is available only for the obstetricians and gynecologists. Takes around 6 months. Hemostasiology, available for people in internal medicine or in lab medicine, and so on. That takes around, again, 1 year of the training. Hand surgery is available for the general surgery, pediatric and adolescent surgeons, orthopedicians and trauma surgeons, plastic surgeons, and so on. Takes 2 years in total. Immunology is a specialist certification. Uh, and theoretically, anyone can do it who has a specialist certifications, but it makes more sense for for example, internal medicine specialists or the pediatricians to do it, because as a surgeon you will not get any benefit of doing an immunology. So it takes 1 year of in total in immunological centers, and 6 months has to be done in a lab. Infectious disease, uh, internal medicines or a subspecialist or the microbiologist or the epidemiologist, virologist, this specialty is available only for these people. That takes, again, 1 year of the training. Coming down to intensive care medicine. Intensive care medicine, sorry, I'm just a bit that can be done through anesthesiologists, surgeons, or internal medicines, pediatricians, neurosurgeons, and so on. It takes around, in total, you are required for 18 months. Now, this here is sometimes confusing. Uh, as anesthesiologists, if you remember that they have already done their 1 year of training in ICU, so when they specialize, they have to do another 6 months of training to get themselves specialized in ICU. But for internal medicine specialists, because they have done only 6 months of ICU training during their specialization, they have to do 1 year of training to get themselves ICU specialists. Then there are pediatric subspecialties, for example, pediatrics, pulmonologists, nephrology, endocrinology, and so on. For that, you have to be specialist in pediatrics and 2 years of training in the further field. The acute and emergency medicine, or the note of Nama asked. Now, this is relative new. Earlier, the note of Nama was this concept has been taken from the USA, because in US you have specialized doctors for the central note of Nama. Here there wasn't, and the note of Nama used to be managed by the doctors from their relative specialities. But now this is relative new and currently in demand. So you require a specialist certification, anything like internal medicine or anesthesiologist or surgery. You have to have 6 months of intensive care medicine, which you already have done during your specialization, 80 hours of training in general and special emergency treatment, which is done through different courses, and 2 years of training in a central note of Nama. Drug tumor therapy, This is uh, available for the fields where you deal with the tumor patients, such as internal medicine, or its subspecialties like pulmonology, or obstetrics and gynecology, ENT, hematology, oncology, and dermatology, and so on. That takes 1 year of training after your specialist training. I don't know this. Sorry, I pressed it wrong. After that comes down the naturotherapy or the homeotherapy. That takes a specialist certification. Sorry, again. Yeah, that takes a specialist certification and different courses and seminars and 6 months of training. Uh, this is generally done by internal medicine specialist and the family medicine specialist. Palliative medicine is, again, you require a specialist in a field that can be anything, such as internal medicine or its subspecialty, surgery, pediatrics, and obstetrics and gynecology, and so on. And after that, you do your palliative medicine through different courses and seminars and 6 months of further training. Sleep medicine. This is again loved very much here in Germany. Yeah, who can specialize in sleep medicine is internal medicine specialist, ENT specialist, dentists, oromaxillofacial surgeons, neurology, psychiatrists, pulmonologists, cardiologists, and so on. There is earlier there was that you have to have 1.5 years of training, which has been removed recently, and now there is a logbook. As soon as you finish your logbook, you can give an exam and you can specialize in sleep medicine. Sexual medicine, which is loved by family medicine, internal medicine, or the psychiatrist, a maximum. You have this is again done through different courses and 6 months of training in that field. Coming down to sport medicine. Sport medicine is done through is generally loved by orthopedicians, a maximum, or yeah, and surgeons as well. Sometimes you have to have 240 hours of training in sports medicine, and you have to do different courses, and you have to have 120 hours of sport medicine activity in a sport club or a similar facility like that. Now, with that, I would like I finished the topic of vital building structure, and we'll come down to the research and research and promotion and habilitation.